Hello, Pulse Poddies, and welcome to our first episode of 2026, where we are doing a deep dive into what is happening in the world of generative AI and the big announcements that have been made in the month of January. George and I had so much to say about this topic, and we hope you find our commentary and insights valuable, interesting, maybe a little controversial. We had so much to say that the recording, which we did in one session, was way too long for a single episode. So I wanted to jump in here to let you know that we decided to split the episode into two. So this episode will be the first part of our conversation on did AI just become the default digital front door to healthcare? And the following episode will be part two of our discussion. In part two, we are going to get more into some commentary, but also some key takeaways, some predictions, as well as the to-do list, some thoughts on what you and your organizations should be doing now to prepare for these imminent changes. So, without further ado, here is part one of our discussion. Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data, proudly brought to you by Pulse IT News. This is our Hot Topics show and the first one for 2026. I'm your host, Louise Schaper.
And I'm your other host, George Margelis.
George, been a while since we've been on air. I feel a bit weird that you and I haven't recorded for a while. So what did you get up to the last month?
I have to admit, Louise, I have missed you. It has been quiet over the last couple of weeks. Literally, I really took the time to sit back and relax. So I did very little work-related and got to enjoy a bit of Sydney sunshine and playing with my granddaughter, which was always a lot of fun.
Oh, nice. And how did New Year's go?
Yeah, New Year's was pretty relaxed here. We just sat back, stayed at home. It was too much of a hassle going out. Like I said, I think Sydney was in a bit of a turmoil at the time. But it's been good. The weather's been relatively good. I've been catching up on some TV shows we haven't watched, having a swim in the pool, quite relaxed.
Any good TV shows? Anything what I should be watching?
So we ended up binge watching one of the sequels to Grey's Anatomy, I think called Station 19.
Oh.
I watched, I think, the first 10 or 12 series of Grey's Anatomy, but then it started getting a bit heavy.
Yeah.
It was interesting, but again, it was pretty much fluff TV. We didn't do anything too intellectual or too stretching.
Nice.
What have you been up to? You've been a bit more hectic than I have.
Oh, nothing too intellectual, but yes, no, I've been traveling. Got to see you briefly in Sydney for New Year's, which was heaps of fun. So thank you. And Marina's biscuits that she shared with me, it's just delicious. But I spent 10 days, I think, almost 2 weeks in Wales and London. So I just got back. I'm still suffering from jet lag. So if I say anything stupid, people, that's my excuse. I'm going to roll with that today. But yeah, did some work. I'm looking at digital health workforce and uplift programs for NHS Wales. And then also had some meetings in London as well with the NHS to talk about interoperability and Sparked and standards work. So I had a really good time and gave myself permission to have a weekend off. And I did something different this time. Instead of just taking myself to go and see things, although I did that as well, I also decided I'd join some meetups and Eventbrite. And so I actually went out 3 times with groups of strangers and met people. Went to 3 different bars. One was a 90s theme where you enter and it's like you're in a blockbuster video. Like they've literally VHS tapes everywhere. And then you walk through like a vending machine because Pepsi was really big in the 90s. So it's like a Pepsi branded vending machine. And it's a real door of a vending machine. Like it looks like a real thing. But you open it up and it's like a speakeasy. And you go into the basement and it's this 90s themed bar. Yeah. And I met some really great people and people from all around the world. Met a couple of people from Greece. So, yeah, I had a really good time as well. To get some good work done too.
Excellent. I'm assuming the weather was a bit cooler there than it is over here.
Yeah. It wasn't quite the 45-degree day that I've been sitting in all day here in Melbourne, but it wasn't too bad. Like the warmest, it was 10 degrees. And I think generally it was like 5 or 6, but I took my big, thick winter coat and that kept me safe and warm. So, yeah, no, it was good. Didn't rain very much, so that was nice.
I'm glad you had a good time, but as I said, it's interesting to see because there's lots happening over in the UK that we need to keep our eyes on, both from a health perspective, but from a geopolitical perspective as well.
Oh, is it ever? I know. Like, we try not to talk about politics too much on the show, but I don't know how much longer we'll be able to keep that up, George. There's so much going on. that is relevant to people's health and the healthcare system. But look, we got some really good feedback from our Pulse Summer series as well. Brought out from the archives some of our favourite interviews, and we've been getting really good feedback on those because I think especially some of the new listeners, they hadn't gone back and listened to the archived shows. Being able to bring those things to the fore, and even though some of them were recorded over 12 months ago, are still so relevant. Even when I was listening back to them myself, I was like, yep, we could have recorded this today. So thanks everyone for your good feedback. I'm glad you liked the Pulse Summer series.
Well, I guess a lot of that reflects how good you were at picking which ones were the best ones to listen to. So I agree. Some of the ones you chose were really quite interesting and jolted my memory. I'll go, oh, we did have that discussion 12 months ago.
Yeah, so I'm looking forward to what we can do next year and revisit some of the shows and interviews that we'll have coming up.
Absolutely.
All right, George, for our hot topics today, you and I had a chat offline and decided that instead of our normal format where we try and cover 5, 6, less than 30, anyway, different stories, there has been one big news story that's broken over the last couple of weeks, and I've been dying to discuss it with you. So I'm pleased that you were up for it. So listeners, today what we're going to be talking about is these massive developments and announcements by some tech AI companies and their plans to significantly disrupt healthcare. Are you ready to have that chat, George?
Let's go for it.
All right. In the last few weeks, 3 big AI players have made explicit moves into healthcare, showing that they're prioritising and productising healthcare as a vertical. They're competing for distribution, trust, and of course, our data. Now, the biggest announcement of all was from OpenAI. They launched 2 dedicated healthcare products, ChatGPT Health for consumers and ChatGPT for healthcare, which is for organisations. Anthropic, they also launched Claude for healthcare. There's a consumer interface, but there's also an enterprise one with an emphasis on being HIPAA ready, integrating into the administrative and payer sort of plumbing of US healthcare, like things like prior authorizations and coding. And Amazon One Medical, which has a limited audience because you have to be a customer of Amazon One Medical. And my understanding is it's just US based at the moment. But they've launched an agentic health AI assistant inside their healthcare system called One Medical. So it doesn't just answer questions, but it takes actions, like it'll help you book appointments and manage routine tasks. So I think let's get started with OpenAI's consumer product, because I think it's the play that many are expecting to be most disruptive, or they just are spending more money on marketing. But it seems that everyone is talking about this, even though it is not yet widely available and there's actually a wait list to get access.
Yeah, look, it's true. Like we took a couple of weeks off and we come back and a whole bunch of trillion-dollar companies are playing in healthcare all of a sudden. And it's interesting because when you look at the time frame, we tend to think of January as a quiet time. But in the US, January is a really busy time. CES happens in the beginning of the year, and that's really the biggest trade show on the world. JP Morgan, which is a interesting conference. I attended that, must have been 7 or 8 years ago. It's a really weird event, JP Morgan. It's not a single event. It's a whole bunch of splinter events spread all over San Francisco. And I have to admit, I found JP Morgan depressing because the discussion was all about money. There was no discussion about quality of healthcare or healthcare outcomes or improving the delivery of healthcare system. It was like, how do we shuffle the trillions of dollars that are spent in healthcare around so that everyone else gets access? But like I said, the big announcements, we've got the big health announcements. CES, there was a whole bunch of other big announcements, humanoid robots, AI tools being used everywhere. It's a busy time.
Absolutely. The list of stories that I had for today's show, I think I had 40 different things we could have talked about. So it was a bit of a tough decision, but I was like, no, I don't know about you, George, but my social media feeds, did anything else happen? Because everyone wants to talk about ChatGPT Health. I've even seen like the morning breakfast shows are covering it, the normal
Absolutely.
press, and it's not even available yet. So yes, it's been everywhere. All right, well, if you've been living under a rock and you're like, oh, what is ChatGPT Health? Basically, it's an option in the sidebar of ChatGPT, which is designed for you as an individual to ask health-related questions, and you can connect pretty much all your health data to it. In the US, OpenAI is saying it integrates directly with the EMR, but it'll also suck in data from your wearables, from apps, pathology, test results, basically your entire medical history. OpenAI are clear that it is not for medical diagnosis diagnosis or treatment, but to assist people in navigating health questions, track symptoms, summarize data, prepare for medical appointments, that sort of stuff. But they also announced that they acquired a startup called Torch, which focuses on bringing together health data that is scattered across multiple organizations. Sounds familiar. Now, George, there is so much to discuss here, and I know you and I have collaborated on the sorts of themes we want to go into today, focusing on what does this mean for consumers, the healthcare system, research, the clinician-patient relationship, and of course, the business models of healthcare, all topics we love to dissect here on PulsePod. So where would you like to start?
This is a great topic. We talk about consumer health. And interestingly, in Australia, back in 2004, at one of the HIT conferences, we actually ran a workshop specifically on consumer health informatics. So the concept isn't new. The application of it is now new because we're actually being able to leverage a whole bunch of technologies to make this possible. And we also have a very different health consumer than we had 20 years ago. So I think we're seeing a bunch of things starting to align. The stars are starting to align, and that consumer health is now becoming a topic of interest, mainly because there's so much challenge in getting healthcare delivery. So I think we can basically start off looking at what the health consumer looks like today and why they would want to use a tool like this and what sort of value does it provide to your average health consumer.
Okay, so where do you think the value lies for the consumer?
Look, the reality is ChatGPT before ChatGPT Health already had 230 plus million users asking it health questions. So there's a interest in health information.
And that's weekly, isn't it?
That's weekly. Yeah. That's a hell of a lot of people asking a hell of a lot of questions. And if they asked all those questions of their doctors, then the waiting list to see a doctor would be 3 or 4 times longer than what it is now. But we go back. I remember when I was young, most households used to have what they called a medical encyclopedia. It's like a book which listed all the common diseases and talked about them. And that was about as much information as we could get. Forward to 2024 with the launch of ChatGPT, all of a sudden you're getting really detailed information. And whilst we keep on hearing about hallucinations, whatever, the reality is the bulk of the information you get from these tools is right. It's good information. So consumers are now in a new position to basically play a much more active role in their healthcare, because the old story of information asymmetry, which is what I was used to when I went through med school. I could access a medical book in a library, but no one else could access it without being a medical student or a medical doctor. Now everyone has access to the same information. And even more so, if you look at this change now with preprints, medical information is being published before it gets into peer-reviewed journals. So often consumers have access to information before even we as doctors do.
Oh, absolutely. Yeah. So I guess big ticks for accessibility and ease of use, probably, even though I haven't had a play with it myself, but from what I've seen, because I'm on the wait list, I'm very, no, come on, OpenAI, let me in. I want to play. So yeah, big ticks for that ease of use. It's available 24/7. Like Bhavesh Patel, when he was on the show last year, said one of the benefits of why he created that AI avatar of himself is he's aware his patients have a question for him. It's 2 a.m. They can't call him. And even if they called at 2 p.m., he's probably in surgery or something. This thing, it's available 24/7. And I was reflecting the conversation we had with Charlotte Blees when she was on the show and the research that's been done to show that actually people tend to be really quite open with these tools because they're aware it's a robot, it's a computer, however they want to think of it themselves, but they know it's not a human. So they know they're not going to be judged. So that's something else that I think the idea that trying to warn people and saying, oh, I don't know whether you should share your data with these things, I don't think humans are going to pay any attention because the literature shows actually, if anything, we're going to be more verbose and we're going to share everything.
And it's interesting because if you look at Charlotte's book, the other thing she highlights, of course, is that when we're comparing these tools to what happens in the real world, we'd have an idealized view of what really happens in the real world. The reality is even the best trained doctors make mistakes. Even the best trained doctors don't provide information in a useful way. So the reality is we have to compare these tools with reality. And we know from To Err is Human, mistakes by healthcare providers kill people. So we have to think about, can these tools do it better or as good? And the fact that they can do it 24/7 when you need it, where you need it, and without a $200 copay. Bit of a story. I got referred to go see a dermatologist for a little skin lesion. The out-of-pocket to see a dermatologist in Sydney is almost $300 nowadays.
What?
I mean, this is, I was shocked. And I have to be honest, I took a photo of my image and stuck it up on ChatGPT. And guess what? ChatGPT and the dermatologist's opinion was exactly the same.
Oh, burn. Sorry,
Yes.
dermatologist. And I'm glad you're okay, George, and confirmed that you got the second opinion from either actually, who was the second opinion? Was ChatGPT the second opinion or the dermatologist?
The dermatologist was a second opinion.
Yeah, of course.
Of course, it took 6 weeks to get into them.
Oh, there you go. Not 6 minutes. And also the cost as well. So the idea that people won't use these tools, they are free. Now, I'm sure they won't always be, but you don't even need to have a paid account. Heroin dealers, their business model is to give you a free sample at the beginning, get you hooked, and then charge you later. So I doubt whether it'll be always free, but at the moment, it is. You don't need to pay any money to ChatGPT to have this amazing tool at your disposal 24/7.
And the reality is the whole ChatGPT model is changing. So at the moment, it's a standalone tool, but smart people are going to start integrating it into end-to-end solutions. And there may well be a cost associated with it, but if it adds value to the transactions and removes some of the costs from the transactions, I think it's going to be an exciting time. A lot of my doctor colleagues came out very early on and said, this thing is terrible. It's inaccurate, it's dangerous, it's lack of privacy. And realistically, that was a knee-jerk reaction because this potentially will take over their jobs in some way or form. Every doctor is going to survive in a system where simple things like small skin lesions or rashes or even medication repeats can be done by an AI tool. So this is disruptive. And I'm not normally a big fan of technology being disruptive, but I really see this as being a big change in the way we deliver healthcare.
Yeah, that's right. A couple of other themes that people will be interested: privacy. My understanding is that how ChatGPT has set up ChatGPT Health is that your data that you give it is not trained for any purposes, like it doesn't feed into the system, and that they're encrypted and subject to privacy protections significantly more so than if you do what 230 million of us are doing now, which is sharing and uploading information just to the normal ChatGPT interface.
Yep. I sent you a link earlier today, Louise, YouTube video, which goes into some of the technical aspects. We probably should share that. But it seems like they've really done their homework. The way it sounds that they've actually got this locked down super tightly so that any information that's part of your health discussion is separate from your normal ChatGPT discussion. They talk about it being in a isolated environment, which is removed as soon as you finish the question. So it sounds like technically they've got that right. But then, like I said, we've raised the question, for most health requirements, is privacy that big an issue? I mean, people are posting images on Facebook and doing things like that. So I think that we need to put it in context. But from the look of what I've seen, and again, I'm not a cybersecurity expert by any means, but they seem to have done a pretty good job in locking down the information. Again, they're now a multi-billion-dollar company. So deep pockets mean there's lots of lawyers buzzing around. So I'm sure they've done their homework.
Yes, they're making a big play here. And of course, OpenAI is not making any money. They're burning through huge amounts of money. And they got to fix that, which is why they also came out over January and said, we're going to start putting ads in the feed. So they're just trialing that now. But it'll be just like all of the streaming services are doing. They give you stuff free or for a cost without the ads. And then if you don't want ads anymore, you're going to have to start paying more for that. But again, I don't think people will care, providing they get value from the information this tool gives them. People aren't going to care if there's ads. So I see this as being a real challenge for the healthcare system because the healthcare system and traditional vendors that work within our enterprise systems, they're never going to have a choice. We're never going to go, we don't care about privacy at blah hospital or blah dermatology clinic. That's always going to have to be a priority. And so I think we need to really completely reconsider how our patient, our consumer clinician relationship is going to change and how we prepare for that. Because I don't see that this is just going to be a little side hustle that is fun and no more disruptive than the whole Dr. Google thing. This is, I think, fundamentally different and it is going to change things very quickly. What do you think, George?
Look, I agree. And the reality is when you look at how people utilize healthcare, there's a small group of what we call frequent flyers who use a lot of healthcare needs. But the average person probably only accesses healthcare once or twice a year. And if you get an ad in the middle of that, it's probably not going to destroy your whole day. Sure, if you're having dialysis and have a cardiac monitor in place and have a internal defibrillator, that's a different healthcare need. But when you look at the healthcare ecosystem, the majority of people access their GP a couple of times a year, maybe, usually just for follow-ups. And if this can do that more effectively, more efficiently, that's going to totally change the model. From the privacy perspective, people have that right to make a choice. They know that as long as they're transparent about how the ads are being delivered and they're put some quality control about the ads. I don't know about you. Sometimes when I watch YouTube and some of the ads come up and my eyes roll backward and I cringe at some of the far-fetched solutions that people are proposing. So I think they need to make sure they can maintain that stability around the information. But the reality is, for a lot of people, this will provide 80, 90% of their healthcare needs. That means the doctors are freed up to do those who need that acute care. And at the same time, it doesn't replace surgery. It doesn't replace a lot of the manual stuff we need to do in healthcare. But even if it just provides peace of mind, although there is that reverse that maybe it also provides extra anxiety. So we need to do some research and make sure we fine tune the mechanisms as we go forward.
Yeah, absolutely. Well, some of the critique that ChatGPT Health has had in the general press, I put out some of the themes that have come up commonly. So I thought we could have a discussion about those. So firstly, one of the critiques is, look, this is just a generic tool. It's not going to know your medical history. It won't know your social circumstances. And again, that's something that clinicians like to think that they have a close relationship with their patients. And many of them do. And hats off to them, because that's the type of doctor that we all want. But most of us don't have that. And I think that's coming from an idealized perspective rather than a reality one. So ChatGPT, just the normal ChatGPT that I use, it certainly knows more about me than my doctor does. We already know a lot of people, especially younger generations, they're already using it as a confidant. Like, they're having conversations with ChatGPT verbally. And in Australia alone, 1.3 million Australians sent prompts to ChatGPT in the first week of January regarding their goal setting for 2026. And often our New Year's resolutions are about health, happiness, and well-being. So how many Australians shared those goals with someone in their clinician team? I doubt if many did at all. And we've discussed on the pod before, how many clinicians, even if they want to, how many of them are able to discuss wearable data like my sleep scores with their patients? So I think it's a very romanticized idea that your GP or one of your clinicians will know more about you than these tools. I just don't think that's the reality for the majority of consumers. What are your thoughts, George?
It's interesting, in the US, they've now partnered with Be Well, and they'll actually be able to integrate a lot of people's medical records from disparate sources. So you'll get medical records from all the providers you access. Now, big call out to our good friend Graham Grief here, because that's all based on FHIR. So that's the FHIR technology developed here in Australia is the enabler for ChatGPT Health to be able to do that. But that means they'll have access to information that others don't have. Now, I did note there was an interesting post on LinkedIn by our good friend Liz Salmo, who looked at when she tried implementing her record and importing her medical record. Now, Liz does point out that her medical record comes to 4,800 pages on PDF.
Thought it would be long, but that's very long.
It's not your average medical record. And she did say that it did struggle to do that and there were some parts missing. So it's still early days, and part of this is going to require us to focus more on how we provide those health records so people can use them for implementing and importing into these solutions. It's got access to that information. You have a whole bunch of other discussions with ChatGPT. How they isolate the health part from the normal part, we still need to see. But you're right. It can store billions of tokens of information about you and utilize that as part of it. It's interesting because they talk about not using the chats as part of their own LLM. I see that. I understand from the privacy perspective, but at the same time, if we actually have that chat information and outcome information, that gives us an opportunity to continue to refine the LLM and make it more relevant to individual populations. So I think there's possibly a lost opportunity there, but I can understand the privacy requirements. But the thing is, this now will become the way we interact with our technology. I've said it before, I'm a big Star Trek fan, and one of my favorite characters in Star Trek is the holographic medical emergency device, which is a virtual doctor. And it literally is an AI tool that does these sort of things. Maybe Star Trek is right. Maybe that's how we will be working in the future.
Oh, God. Yeah, I hadn't even considered that this could eventually become a holographic interpretation of a humanized form. Oh, okay, well, that'll be a future podcast is when we discuss Elon's working with Sam on that or something. Okay, so generic tool that won't know your medical history and won't be personalized. We've just debunked that. The next critique is the idea that people are going to be bombarded with medical misinformation. And look, I expect that is not going to be as true as it has been in the past, and interested in your thoughts on that, George. But we also know that even though these tools are not perfect, what has the healthcare system actually done to combat the problem of misinformation? We talk about it often on the show. We've had Tina Pernat, who's a global leader in this space. She's trying to get the health system to pay attention. But basically, we're doing bugger all to modify what we fund in healthcare and putting efforts towards wellness, literacy, preventative. And while this tool is very much a simulated personal relationship, it doesn't feel simulated. So I think people are naturally going to trust this tool, and some are going to move their loyalties towards AI and actually away from trained professional clinicians. That is not a good thing, but I don't see that there's many barriers to that happening. I think people have a few good experiences, they find it valuable, all of a sudden it's really quite quickly changed their thought process.
It's interesting because we talk about the personal relationship with doctors, but then when you see stories of 6-minute medicine, and I read an article somewhere that some of the third world countries, the average time of a medical consultation is less than a minute. So
What?
is that a personal relationship? He really is. So
Give me a script. Okay.
exactly.
Done.
It's literally, what have you got? Here's an antibiotic, go home. And I was shocked when I read that, but it's true. In third world countries where there's a huge shortage of healthcare practitioners, some consults are less than a minute. And even now, we still have this idealized vision of the good old family doctor who delivered the last 3 generations of our family, but that doesn't exist anymore. You go to your local medical center and you don't know who you're going to see. I've got a regular GP, but mainly because I know him from med school, and also I go 4 times a year so I can get in when I need to go to. But I look at some of my other relatives who have more acute healthcare needs. The same doctor's not always there. And let's be honest, the same doctor is not always in a good mood when you get there. So that personal relationship thing, I think we need to take with a grain of salt. The other thing, of course, is medical misinformation. In some countries, the Secretary of the Department of Health promotes medical misinformation. So we can't really complain
It's so not funny.
if AI does it. And the reality is, again, if you use the right tools, if you feed the LLM the right medical information thing, one of the interesting things that came out of this discussion is the launch of HealthBench at OpenAI, where they use that to compare the accuracy of the AI tools. And that's really a physician-led, very accurate sort of benchmark tool they're using for comparing these things. So I think whilst with our knee-jerk reaction is to say this medical misinformation can be delivered, and we use TikTok and Facebook as an example of how that's done, that's because that's all around driving clicks. This is not around delivering services. So hopefully they get this right and think about it.
That's it. The business model drivers are different here. And ChatGPT is not the only tool. There'll be more, but they're the first really at this. And they keep improving the models. Like I was archiving some of my old chats today, and like the quality of advice and content I was getting even a year ago, now drastically different. It's so good. All right. What about the other critique about this isn't a regulated device?
My understanding is that's purely because of the liability issues. It's a huge issue to have a regulated device. So they come out front and tell you this is an advisory tool and you use it in conjunction with your healthcare provider, and don't necessarily take the advice as given. I think the regulation models are going to have to change. So we're going to evolve over time. If we can demonstrate accuracy, we can demonstrate there's a responsible mechanism behind it. Let's be honest, there are doctors who have bizarre opinions as well, who are regulated. So yes, sure, they get into trouble, but the damage still happens. I think at the moment, this is a limiting factor, and that's why they're promoting themselves as a consumer information tool. But
Yes.
At the end of the day, people are making decisions based upon it. I'm sure there's a whole bunch of lawyers floating around looking for opportunities to sue OpenAI. But then again, if they're losing $15 billion a year, there won't be much money there to sue them for. So that may struggle.
Yeah. And look, I agree. And it is a concern. But we've talked about this again on previous shows, because I don't know how you would even go about regulating something like this. And to think of this as a competitor to software that exists within the enterprise systems of healthcare, it's like apples and oranges now. Like software in healthcare is always going to have to be regulated, of course, and we would have it no other way. But it means that because this sits outside of the healthcare system, it's directly to consumers. I just couldn't think of what levers government would possibly have to regulate something that is a direct to consumer where they don't have any visibility. There's no auditing going on. No one's going to actually say to the government, oh, unless I have a very bad experience in which I hire a lawyer. And, and a few people have, especially in the States with some of the mental health stuff that has been done very poorly in the US. But again, these tools are just going to keep getting better. And again, if I've got this tool that seems helpful to me, it's free, it's 24/7, do I give a shit whether it's regulated or not? No, I just don't think people are going to care.
And the reality is, like you said, there will be some bad outcomes and they may well take legal action. And I think the fact that it's not regulated will protect them as a legal defense. But then again, a lot of doctors and chiropractors and naturopaths also get sued for bad outcomes. So they're basically in that same game. And if they get a lot more right than they get wrong, that sort of puts them in a positive spin. Now, the monetization is another issue. We could look into that. But the reality is people still need to make the ultimate decision about whether they follow the advice or not. And let's be honest, if the advice is telling you to stop smoking, exercise more, and stop drinking alcohol, you really can't sue someone for telling you to do that.
Yes, that is not news. Yeah. And look, I get the concerns with this, but again, I just don't think it's going to be something that the general punter is going to care about. It's a black box. There's no research on which user prompts and integration paths could lead to harmful information. There's no published studies testing the safety of ChatGPT Health or equivalent tools. And there's a lack of shared responsibility. So while we in healthcare might not agree that a legal disclaimer means that OpenAI isn't responsible, it's going to be, I think, some time and it'll require pretty big court case before courts will determine otherwise whether there is a shared responsibility on OpenAI. In the meantime, they have gobbled up a bunch of data. They've got customer loyalty happening. Like, it's a pretty smart play.
And it's interesting when you look at the technology behind them, and they've seemed to have gone to a lot of work to make it safer. So when things are very high risk, they basically come up with things like, go and see your doctor, or we can't give you this advice. So there are built into it from what I understand. But again, it'll be an evolving experience we need to keep our eyes on.
Yeah. Well, time for a quick break, but George and I will be back with you very soon. We have lots more to say on this topic. Okay, and we are back. George, one of the things I think we need to talk about is what this means for the changing nature of the clinician-patient relationship. While we all know about Dr. Google, of course, this is a whole different ballgame. Like, we are talking about patients are now going to be way more informed, and I expect that they're going to be more demanding because of the advice that they now have from ChatGPT, which is specific to them, which is so much different than generalized Google searches. So I'm hoping that what this could lead to is better shared decision-making, because the balance of power is going to level up, because that information asymmetry that currently exists between someone with a medical degree and someone with lived experience, but not a medical degree, that's going to become less of an issue. And of course, most clinicians that I know, they all say their best patients are the ones that have maybe some challenging things, so it's intellectually stimulating for the clinician to help them. But they all want patients who are informed, proactive. I do think there's something here with that changing dynamic and how clinicians need to pretty much now start preparing themselves for what that changing dynamic is going to mean for them in their practice and their workflow.
Absolutely. Look, the biggest challenge we face at the moment is the way our medical system is run around these 6-minute consults and in-out type medicine. If this provides us an opportunity to spend quality time with patients who are already informed, so we don't have to go through the whole process of explaining what their disease process is. They've already read the latest and greatest information about that on their ChatGPT Health. They know what their symptoms potentially mean. We then have an ongoing discussion, and it becomes shared decision-making with shared responsibility. So again, the patient plays a much larger role in deciding what treatment they want, no longer just being told this is the treatment you're going to have. It puts the onus back on the consumers to play a more active role and do their homework. And we now have the tools for them to be able to do that homework. Some people will push back against it and say, I just want the doctor to make that decision. But the reality is that now have the tools for you to make a shared decision. Doctors need to work out how to communicate that better. And going back to the good old days where you sat down and had a long chat with your doctor, not just, I've got a pain here, here's the script, see you later. It's going to change the way we deliver healthcare. Now, whether the funding models reflect that, because this may well mean that you just spend 30 minutes with your doctor having a detailed discussion rather than 6 minutes. If you're still paid the same amount as you are paid for 6 minutes, that's going to be a problem.
Oh, absolutely. I agree. So I think that there's a whole bunch of work that needs to happen, quick, smart, by the professions and by individual clinicians and by employers, really looking at what this means for the changing role for clinicians. So rather than be threatened or have negative interpretations of what this means, there's some really positives that can come out of it, providing that we don't hold true to older ideals of I as the clinician and the source of all information and power. And this is how it works. There's some really fabulous roles for clinicians to be more navigators and guides and interpreters. And to remove some of that, drudgery from their work, because for some of you, you'll be able to get, patients who are more informed and you're able to have a more equal conversation and do those shared decision making. But like you said, George, then we need business models who are able to back that up.
Yep. Look, you're going to be sharing the responsibility and sharing the risk. So it's going to require us to have a different mindset about our interactions with the healthcare system. And I think that's part of the evolution going forward.
Yeah. Outside of the role for clinicians, what about the tech sector? So what do you think that the impact of this could have on traditional software companies that provide not direct to consumer, but enterprise grade systems? And of course, we have the huge interoperability agenda as well.
It's interesting because these tools can now import information as long as it's provided in the right format. And if half the world is using these tools on a regular basis, there's a strong demand for the software providers to make sure that they can provide medical records in the right format, information in the right format, interfaces that work closely with this. So I think it changes the model. So we start looking at a platform sitting upon these AI tools that software vendors and solution vendors can integrate into. And that provides them with some, again, business challenges because they're reliant on a big multi-trillion-dollar company partner whose decisions can negatively affect them at the drop of a hat. But it also means that they need to collaborate and cooperate and with standards and do those sort of things that we've been talking about for many years. So whether this is the thing that bulldozes standards through, because if you don't deliver to the standard, you can't integrate with these AI tools and everyone's using these AI tools. So therefore your software doesn't get used because it doesn't work with these tools. So there are some economic drivers there. I'll tell you one thing I have noticed what this has done. The rise of AI has changed the environment of software developers. People no longer focus on the quality of their code, it's their quality of their solution. So I think that makes a big difference as well.
Yeah, okay. And that's a really interesting point as well. And yes, like this could, I agree, really help with the interoperability agenda. And some of the companies in Australia who are really leading the charge, working with Spark, which we talk about all the time, and of course, Australia being the home of fire, hopefully it's given them a bit of a leg up. But I think we're going to see that demand for interoperable, shareable health data, but also not straight away, but probably within a couple of years, we're going to have to work out how the outputs from a generative AI tool, whether that's ChatGPT Health or another tool, how should that output be reflected into the clinical records that are held by the clinic? And how do we adjust clinical workflow? And there's a software component of that as well. That's a bit futuristic, I think, but I don't see it as being science fiction.
Absolutely. Yeah. Again, the way we deliver healthcare can be radically changed as a result of these tools. But trying to imagine what that is, I think we just need to watch it evolve and keep those guardrails around that patient outcomes remain the primary focus.
Yeah, absolutely. And then for the technology vendors that are in the startup community, we have also talked about this, George, as well, like that this consolidation by big companies and what that means for smaller ones. But I did a bit of research on Torch because, who's Torch? I hadn't heard of this startup. And no wonder I haven't heard of them. It was a 4-person team. They were building an app that combined people's medical information for AI use. So Torch called it, and I quote, a medical memory for AI, unifying scattered records into a context engine. Now, one of the reasons I think I hadn't heard of Torch before OpenAI said that they'd bought them, it's only 4 people that work at this company.
$25 million each, is that right? They're going home with?
Oh, they have to go work for OpenAI now. I'm sure they're quite happy to do that because they would have been paid a significant sum. But they were founders from Forward Health. And it wasn't so long ago. It was late 2024. You and I discussed on the pod Forward Health, which was one of those doc-in-a-box solutions. And they'd raised like $400 million US. And of course, it didn't work. They didn't really get very far in their journey at all. And they shut down the company. And it was all over Red Rover. Well, they went and set up Torch. And this 4-person company has now been acquired by OpenAI. I'm thinking if you're a startup in the healthcare space, even if you're not AI, I don't know whether this is great news. I think this could mean that you really need to position yourself for acquisition by a decreasingly number of few huge players, because it's probably going to make procurement actually even more difficult.
Look, haven't had a chance to actually use Torch because when I went to their website, it basically comes up with a big thing saying now that we've been bought by OpenAI and go over to OpenAI. I've seen no evidence that they actually had delivered on that promise of making their information totally available, interoperable, and hopefully OpenAI did their due diligence. But at the same time, I guess $100 million for a company like OpenAI is petty cash. I remember I've seen some acquisitions of companies that in hindsight have not been the best decision people have made. So this may or may not fit in that space. The reality is startups are going to need to work out what their role is. They can't compete with OpenAI. They need to work out how to be either symbiotic with their OpenAI or make themselves an attractive target and get bought at the right time. But that then brings us into that business of software solutions in this space. Do they focus on their financial models, which is going back to my discussions around JP Morgan? Is success having a $100 million sale, or is success saving someone's life? And that's the sort of discussion we need to have at a society level.
Absolutely. Well, one of the things that I also think we need to think about, and here's a prediction. We'll get into predictions in the second half of the show, but here's one I'll get started us with. I think by the end of 2026, we are going to see, and this is globally, but we are going to see a huge upswing in the expectations of consumers to have access to their own health information in full. Sorry, my health record, but even though you're re-architecting it, and I'm really looking forward to seeing that, it's always going to be a summary information. My test results are there, fabulous, but it's a summary. And I'm going to want, and I think a lot of consumers are going to want, full information as much as possible. Consumers are going to be expecting this so that they can take that data and do what Liz Salmi has done with her 4,800 pages and feed it into an AI model and look for insights. So how do we prepare our workforce for that? How does this fit with our current EMR rollout timing projections? Like, still a lot of healthcare in not just our country, but many others still is mostly on paper or in a system that's siloed off from the rest of it. And how does this impact on government policy at state and federal level? The rising expectations of consumers to have full access to their information. I don't think going, you can fill out a freedom of information request and maybe in a few months we'll be able to fax you some things. I just don't think it's going to fly very long.
So I'm not quite as optimistic as you. I don't think it'll be a 1-year event, but I think over time, and again, as the demographics change and as the Gen Xers and the millennials come into play, they'll have a greater expectation that they'll have access to this information. Same sort of way their financial information now. And you've got to give some credit to the Australian government because my health record was that model back in 2010. So they've been
very prescient
trying to deliver on that model. The reality is that up to now, it's been hard. And it's really only things like FHIR that have enabled that to happen more effectively. And the re-architecting of it is important, but their hands are tied by the constraints of being a government entity. So whether the private industry sector takes a greater role, and like Torch or tools like Be Well, May Well, come into play, or whether the government loosens some of its restrictions and makes it more available. But the reality is, in Australia, the government could take more of that information from healthcare providers. It could be part of your Medicare requirement. If you want to get a Medicare rebate, you've got to share X, Y, Z information with the central system. Whether it becomes a national model, whether it becomes a local model, there's a whole bunch of things we need to get our heads around. But the reality is, The demands of consumers are changing the same sort of way that they've changed in other industries. Healthcare's been a bit slower than doing it, but it's not immune to it.
Yeah, no, absolutely. Okay, jumping in here to say this seems like a good spot to wrap up today's episode. When we come back with part 2 of our conversation, we will continue where we kicked off. George and I will be discussing what these moves mean at the enterprise level of healthcare. We're going to be discussing some key takeaways, our predictions, and of course, that promised to-do list that you're going to want to write down. So I hope you've enjoyed part 1 of our discussion, and we look forward to bringing you part 2 shortly. And in the meantime, I'm going to read us out. Thank you for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thanks to Emily Mara at Pulse IT for all her support. Big thanks to everyone for listening. Please make sure you subscribe, follow, rate us, and please share this episode. We think it's an important one with all your friends and colleagues. And visit Pulse IT News to catch up on all the news from Australia, New Zealand, and Ireland. Of course, George and I always welcome your feedback, so please send your thoughts and feedback to us via pulsepod@pulseit.news. We always love to hear from you. Have a great day. Speak to you soon.